Good morning, Virginia. This is Virginia This Morning.
This Partners in Healthcare segment is sponsored by First Med.
It's the company that cares. First Med offers transportation services to and from home, the hospital, assisted living, or nursing facilities, spanning all the way from Northern Virginia to South Carolina. Paul O'Brien and Randy Watson join us this morning. Thanks for coming in, you two.
Thank you for having us.
We were just talking about the company getting started. Let's start at the beginning and explain what is First Med and how did you guys get started?
First Med started on the Eastern Shore of Virginia with a couple of ambulances and has now grown to more than 100 vehicles and doing more than 100,000 transports per year from Northern Virginia to the South Carolina state line. 100,000
is quite a lot. Did you guys ever expect that the demand would be that big?
Well, there's a great demand for ambulance transportation, whether it be coming from a patient's home or long-term care facilities to and from a hospital. So there's many instances when an individual would need transportation.
I think that's the thing that you're not typically so familiar with until you've used a service like this. You think of an ambulance with emergency services, but that's it's a different case.
It is. We are a non-emergency, for the most part, transportation agency. We handle the trips from the hospital back to the nursing homes to dialysis. For the folks that are medically fragile, and there's really no other safe mechanism to get them to where they need to be.
Absolutely. It's not a situation where you're thinking, I need a transportation home from the hospital, I'll just hop in the back seat. These are sustaining rides where you have medical needs.
Correct.
For that transportation.
There's always an underlying medical condition with the patient that can make it dangerous to go by a private vehicle without trained folks to care for them.
Are these one-time only services, or do you typically work with families and customers that have been with you for a while?
Actually, we have a lot of patients that we work with several times a week, whether it be going to and from dialysis treatments or wound care treatments or for cancer treatments, those types of things. So our professional and compassionate EMTs develop relationships with those patients and get very close over time.
Absolutely.
So we do care about each individual patient and have a real commitment to quality.
I was going to touch on that. The customers demand that, and especially this scenario demands that commitment to quality. How do you deliver on that? What is the focus?
We have a core set of beliefs and values focused around customer service. We are modeling ourselves over companies that have world-class customer service, and we've the patient comes first. They're always greeted warmly. We've deployed some technology in our ambulances to help provide real-time feedback to the drivers to provide a very comfortable and safe ride for the patients in the back. As you can imagine, riding in the back of an ambulance the first couple of times can be fairly distressful. So to provide the feedback to the drivers is key to helping with that customer service.
Absolutely. As we were saying, you develop that relationship, and I'm sure that brings the comfort level to a good level playing field.
It does, and my role with the company is Director of Quality Assurance, and each individual, each facility, case managers, social workers, hospitals, long-term care facilities, they all have access to a quality assurance individual that will make sure that we are meeting those world-class customer service levels all the time.
Are these services arranged for by the doctor or the facility, or is this just something that a family can call and say, we need to coordinate transportation and we'd like to work with you?
It can range from an individual calling in, and a lot of times social workers and case managers in hospital facilities or in long-term care facilities will arrange transportation for their patients for safe travel.
Absolutely. Well, thanks for introducing us to First Med. We appreciate you guys coming in.
Thank you for having us.
Have a great day. You can learn more about First Med and let them assist your transportation needs. Visit at 3000 Impala Place in Richmond or set up a transport. Call 1-800-734-4161. And you certainly can always visit online and learn plenty about First Med at firstmedinc.com.